is wealth, they say. He who has health has hope, and he who has hope has everything. We are broadcasting live at Dr. Nuruddin Olowopopo's clinic, Isolo, for the Eco Club International Medical Outreach. Eco Club International is a social-cultural group of Lagosians in diaspora, primarily invested in contributing to the development of communities in Lagos through empowerment and support initiatives geared towards the advancement of humanity at large. Eco Blog is right here to bring you details of today's event as it unfolds. I am Olayinka Olorunshola. Please stay with us.
Good health is underrated, and as a result, the rate of death keeps increasing by the day. Efforts have been made to reduce this, and that is why the government keeps providing healthcare services to the citizens, but not everyone can afford it. Due to the situation of the economy and the inability to cater to the health demand of every individual in the country, the good people of Nigeria come together to provide healthcare services at the grassroots level, especially for the older generation. One such group is a social-cultural group in the diaspora known as Eco Club International. This group of individuals is known for their contribution to immediate society. One such contribution is the medical outreach that was organized in Isolo, Lagos to sensitize the people of Isolo and its environment on how best to take care of their health. They also provided medications and hampers to give out to everyone that attended the program. The day started with people arriving at the Dr. Muhyiddin Olowopopo Memorial Clinic and Isolo City Hall, which has always been the venue for the outreach. The Governor and First Lady of Lagos State was represented at this outreach. Beneficiaries were seen comfortably sitting and waiting to be attended to by the medical officials. Members of Eco Club International were seen trying to register everyone present and fill in details of their medical reports and also give them the required medications where necessary. Tests were carried out to determine the best medication to be given to each beneficiary. A member of the club, Otumba TJ Abbas, addressed everyone in attendance and appreciated members of the club for their continuous support in the successful completion of every project and outreach planned.
This would not have been possible without the resourcefulness and the support of our members. They are the ones that made this organization what they are. All members of the Eco Club International, wherever you are, please give yourself a big round of applause. God bless you all.
Representing the Governor of Lagos State, Babajide Sanwo-Olu, Mr. Jamin Sanwo-Olu, commended the efforts of the Eco Club in giving back to the people as it goes a long way in helping them.
From the Governor of Lagos State, Mr. Babajide Olushola Sanwo-Olu, there's the Governor of the Center of Excellence, the City of Aquatic Splendor, the place that we all call home, this Eco, this land of opportunities, flowing with milk and honey. This land flowing with great people, with great ideas. This land that attracts opportunities all around the world. He brings greetings to all of you. But I would say special thanks to this group of people once again, Eco Club International, who have over the years dedicated themselves towards giving back to the community through these healthcare medical missions. We want to say a big thank you to you, and we say we recognize your efforts and commend you and encourage you to even do much more. This is no small event. As Her Excellency said, that from the 7th till the 21st, they will be going around different areas of Lagos, the regions, from Ikorodu to Badagry to Ikeja to Lagos Island and mainland, and Ekpe, touching lives, changing people. They said the health is wealth, and the investments you are making in the health of people, of Lagosians, is what is making us wealthier and better and greater. And we want to give you a big round of applause and commendation for that. So, Ebami Patewo fún àwọn Èkó Club under the vision of Honorable President Saheed Olushi.
He described this as a gesture worthy of emulation by others as he advised other individuals and groups to do the same.
The governor of Lagos State set up this Office of Diaspora and Foreign Relations to particularly encourage, to inspire, to inform, to help integrate and facilitate investments for diasporans around the world. And we are so glad to see that you serve as a beacon, you serve as an example, you serve as a role model to other diaspora organizations around the world of what diasporans should be doing. Not just about getting, but about giving. Because they say, when you give, you also get. And I will tell you that the governor has seen, and he is seeing what you are doing, and he will respond.
He assured them of the continuous support of the government in their activities.
We will be with you, even as I'm aware that you are partnering with the Ministry of Health, the Permanent Secretary, the Omnoli Commissioner, the Office of the Governor and First Lady, to carry out all these things, even as you have individually contributed, and we are supporting logistics in some areas. But you have given up yourself, and no one can take that from you. And we'll celebrate you for doing that. We will be with you. I'm a duo team. We will support you. We will guide you. Whatever thing you want from the government, in the best of our ability, we are telling you that we are committed to supporting you now and henceforth. So keep up the good work. May God bless you again. And may we all keep on working hard for a greater Lagos. And as I said in the beginning, Eko Onibaje o.
Dr. Ibirunke Sanwo-Olu, who was represented by Dr. Abiola Mafe, spoke about the effort of the Lagos State government to make sure the healthcare sector is well taken care of and citizens can benefit from it.
I'm happy to attend the formal kickoff of the 2022 medical mission organized by the Eco Club International as a free healthcare intervention directed to reach out to people requiring medical needs. The administration of Mr. Babajide Olushola Sanwo-Olu places a high premium on the health of residents in line with the second pillar of the theme's agenda for Greater Lagos. This has been reflected in the construction of more hospitals, procurement of modern equipment, training and welfare of medical personnel, and also consistent free medical outreach across the state, amongst other initiatives. Therefore, the free medical mission by Eco Club International is aptly in line with the programs and initiatives of the Lagos State government to ensure unhindered access to medical care for all. As a member of the medical family myself, I have a reasonably fair idea of the quantum leap that interventions such as this medical mission will give to healthcare delivery in the state.
She commended the Eco Club as their outreach is just in line with what the Lagos State government has been doing to ensure quality healthcare for its citizens.
It is also commendable that this is the 7th medical mission that Eco Club International is carrying out in Lagos State. And it is also designed to provide free medical outreach, including surgical interventions and free medication to residents in the 5 administrative divisions of the state, namely Ikeja, Badagry, Ikorodu, Lagos Island, and Ikpe. Being a philanthropic organization that is non-profit oriented, I must give special kudos to the leadership and members of the Eco Club International for the initiative to establish the organization and consistently deploy it as a platform to engender socio-economic development and invest in worthy causes, especially humanitarian projects. It is also interesting that this is an organization founded by Nigerians in the diaspora with origin and affiliation with Lagos State. And since year 2000, when it was established, records abound of how members are giving back to Lagos State and the people of the state.
Oba Kabiru spoke about the efforts of the club so far and how much they have helped the community. He advised every beneficiary to follow whatever advice was given by the medical experts and to use whatever medications they are giving regularly.
ọ̀rọ̀ tí èmi fẹ́ bá yín sọ ò ní pé ọ̀tọ̀ ni kéèyàn sọ nǹkan tó ń ṣe fún ẹni tó máa wò ó sàn, ọ̀tọ̀ ni kó fún yàn lóògùn kéèyàn lóògùn ẹ̀ lásìkò àti ìgbà tó ní kó lò. ṣé lọ́pọ̀lọpọ̀ yìí màá ti ẹ̀ ń bọ̀ bí kò sẹ́ni tí ò ní kankan lára tó fẹ́ wò. ọ̀pọ̀lọpọ̀ yóò yẹ kẹ́ mú àbúrò yín ẹ̀gbọ́n yín àwọn ọmọ yín dání, kì í ṣe yín nìkan ṣe.
As the outreach continued and more beneficiaries were attended to, we were able to speak to some of the members of Eco Club and also beneficiaries who were full of gratitude.
Eco Club International is an organization, umbrella organization made up of about 27 or 28 chapters within the USA, Canada, and UK. Basically, we are a social organization, but at the same time, we also give back to our community, both in the US, Canada, London, and here, of course, in Lagos. This medical outreach is a very significant one because we normally have, since 2007, we've been having this medical mission. 2 years ago, 2020, as we all know, was COVID. Very unfortunate. We weren't able to have it. So this marks our comeback of our medical missions. So today it's today is extremely significant because we're kicking off the mission at our home base, which is the Int'l clinic that we built for the community in Int'l. So that's the significance for today. There are always challenges. We have challenges all along the way. Like I told you before, I'm the chair of this mission. I haven't slept peacefully for 6 hours in over a month, because there's always been one thing or another, because remember, I'm in the US. And so funnier thing is that the whole committee, we're all in different states. And then we have people here in Lagos. So we're all doing it from that. So we have a lot of challenges, but as you can see, we're able to overcome most of them. Yes, there's small little hiccups in there, but we'll learn from what happened today and tomorrow will be better.
Eco Club International is what we call a 501c organization in US. That means we contribute, and selfishly we do what we can for the community that we serve. Our major community service is the ECI medical mission, which we're doing today. That's the key of ECI project. We do have other projects in line, but this is the major one that we service our community. I can say it's so much of a challenge because when you volunteer to give back to the community, it's a selfish commitment. So the challenge is trying to meet as much people need as you can. And that's the challenge.
It's a group of faithful Nigerians in diaspora from across the world, like you said, diaspora, who came together to give back to humanity, So, and they support their members in their community, different communities across Lagos. And they give, like last year, I've been with them since last year, volunteering with them. They do a lot of medical outreach. They do a lot of other social activities, which is amazing. So especially I volunteer with them on the medical outreach, so I can actually talk more about their medical outreach that they give back to the community they decide to work with.
This is basically to benefit all the needy people in our home country. This is to help them to achieve medical benefits. Some have ailments that needs to be treated, and that's the main reason why we're here today. Well, not necessarily, because we've actually added some more now that we do it every 3 months to benefit the people of Lagos State. Again, is to help our people significantly, because we know the importance of health. And the reason why we are here is to help them to make things a little more better.
Well, I'm very happy. It is for me, it's a ritual because they do it yearly, and I always welcome them to my constituency. Because it's a thing of pleasure. One, it's an opportunity for them to give back to the society. You know. Two, it's an opportunity for them to also mix, interact, and know their people. You know. And finally, it's a thing of joy for them too. Because, I mean, no matter what, after spending so many years abroad, and here you are trying to serve humanity, it should be a thing of joy for you.
This is to benefit the citizens of Nigeria, especially the Lagosians, because we that come from abroad, we like to give back to our community, you know, because the community has been good to us. They have raised us, you know. I personally, I was trained at Lagos State School of Nursing, and I got my nursing degree for free for going to abroad, you know. So I like to give back to my community, and that's why I'm here. We help to prevent diseases, diagnose diseases, and also, you know, put back the patients that need follow-up. Will align them with doctors so that after we leave, they can continue to take their medications and follow up so that, you know, early detection of diseases is the best way, you know, to cure the diseases before it gets worse. Yeah, we get a lot of challenges, but it's not that it's, we surmount any problem that we come across, and, you know, we just move beyond. Because in life, you're going to meet challenges, you're going to meet problems, but how you deal with it, that's the most important thing.
Privilege ni ilé jẹ́ fún èmi, you know, to be standing here lénìí yìí, nítorí mo rántí nígbà tí ó jẹ́ wípé ilẹ̀ yìí ó wà ní ilẹ̀ gbẹrẹfu, tó jẹ́ wípé wọ́n fún wa, ọpẹ́lọpẹ́ àwọn members wa tó jẹ́ wípé wọ́n jà pìyànpìyàn, àwọn bíi Ọ̀túnba TJ Abbas, àwọn bíi kí lorúkọ ẹ̀, our former president ọmọ Arómiré Onílẹ̀, àti Bisi Gaji, and more people, and Kábíyèsí Ọ̀sọ́lọ̀ tó fún wa ní ilẹ̀ yìí, tó sọ wípé ṣe ẹ gbé síwájú mi, ẹ gbé sí ibi báyìí, a dúpẹ́ lọ́dọ̀ Ọlọ́run. So for me láti dúró sí ibi báyìí, privilege ni fún èmi, nǹkan tí èmi rí ọpẹ́ lọ, you know, talking about àwọn tó jẹ́ wípé wọ́n make it to happen. So like my vice chairman said, yes, we are giving back to the community. A dúpẹ́ lọ́dọ̀ Ọlọ́run pé a rí community tí a padà wá bá. Tí ò bá sí community ńkọ́, a kàn ṣe níbi whatever tó jẹ́ wípé a ṣe lọ́hùn, whatever tó bá jẹ́ wípé a attain lọ́hùn, àní lè rí ibi padà sí àdúpẹ́ lọ́dọ̀ sọ́lọ̀ tó fún wa ní ààyè àti Dr. Olówó Pópó himself olúwa ṣeun àdúpẹ́ for being here and kìíní yìí ń sìn kò kí ń ṣe nǹkan tó jẹ́ wípé wọ́n bẹ̀rẹ̀ ní àná iṣẹ́ 25 years ni over 25 years tí wọ́n ṣe rìtìrìtì tó fi jẹ́ wípé wọ́n fi mọ̀ wípé ó yẹ ká mú nínú nǹkan tí a jẹ kò kí ń ṣe pé nǹkan tí a jẹ kù bí a ti ṣe ń jẹ lọ́hùn náà là ń mú wá sí bíbá ọpẹ́ ní fọ́lọ́run fún àwọn tó jẹ́ pé wọ́n rò ó pé ó yẹ ká ṣerú nǹkan báyìí. So to me, like I said, privilege ni ẹ tún wò wọ́n tún lọ ṣe inscription sí ibẹ̀ yẹn that means tí àwa bá tiẹ̀ lọ the inscription will be there and this building will continue to be here. Àwọn presidents tí a ti ní tó jẹ́ wípé wọ́n fan that flame láti jẹ́ kó ṣáà máa jò. Ọlọ́run á bùkún àpò wọn, Ọlọ́run á bùkún wọn, Ọlọ́run á fún wọn ní àlọ́rẹ̀ ẹ̀mí wọn.
Eco Club International is about giving back to the society. Most of us based in the US. So once in a year, we come to Nigeria and give back to our community. As we all know, we have a lot of Nigerians that they really need this medical care that is not being provided. We have many people, millions that they don't have access to good health. So we are here to help. We all have to join hands together to help, just to give back. The most important thing is education. We educate people on what to eat. We educate people on what to do and not what to do. That pertain to, there are many things that we can prevent when we know what to do. Everything is not about medication. Everything is not about, like people that have hypertension, there's sometimes certain things that they're not supposed to eat. But in Nigeria, we eat a lot of salt. And that's the biggie for someone that have hypertension. That's a no.
Eco Club International is about giving back to the community. To whom much is given, much is expected. We want to thank God for the opportunity that He has set us up at this platform. And we thank Him for the enablement for us that He has given to us to be able to give back to our community. We are here to provide free services to the underprivileged, the disabled, to give them all the health care screen, blood pressure screening, blood sugar screening, cardiovascular endocrine status assessment, and also we have some free medications. We are also going to do some projects, some minor procedure, whatever they have, implant, maybe endoscopy or minor surgical procedure. We are here to give back, to help, to enrich our people, and also to make awareness how important it is to have their health care checked every time. Remember, health is wealth. Of course, with everything, you will see one challenges or another. But we want to thank the governor, Governor Sanwo-Olu, for partnering with us with this laudable project. That with the deficit, the challenges is not that pronounced. We're able to overcome it. We thank him for the opportunity, and we thank all his staff for helping us and supporting us and partnering with us with this project.
Eco Club National is all about giving back to our community what we know how to do best, and as an organization where we see to people's health, and what we do is to give back to what we've got over there, and we're happy to do it. What we should be expecting today is to see people and see less privileged people and they are unable to see their local health care center, able to do the assessment for them, do intervention, and at the same time we refer them back to health center for follow-up, because it's free. That's what we do, and because we are giving back to where we come from, I'll make it a free medical mission to all Lagosians.
Eco Club International, it's an organization of eco children, eco indigenes in diaspora. We are all over the world, and we have chapters, over 29 chapters around the world. All we do is giving back to the community in Nigeria and within our chapters as well. Health issue is very prominent in the community, and we think that because we have a lot of professionals among us in the diaspora. We need to give back to our community through giving free medical care, from consultation to free medications, telling them about how they should take good care of their health. We brought doctors, we brought pharmacists, and surgery is going to happen, dental, everything that pertains to health is why we're here. And it's the significance of what we are doing. There will be challenges, but God Almighty has been helping us to make sure that it takes place. We have partnered with some people as well, like Lagos State is partnered with us, and some other individual companies, sometimes they partner with us. So it has been able to help us meet our challenges. I'm blessed and I'm happy to be part of Eco Club International because I'm able to be part of the people giving back to the community that I came from. I mean, we are all good products and we are using our services in diaspora. Why can't we give it back to our own community? That's why we are here.
Eco Club International is a service organization with chapters all over the US, Canada, and the United Kingdom. The core objective of our organization is giving back to the communities where we live in the United States, Canada, and the UK, and also giving back to Lagos State, our home state. And that's why we're here today to give back. We're in Solo today to do a medical mission. So this medical mission is what we do every 2 years. In the last 4 years, we haven't been able to do this because of COVID. So this is our first point of call. We're going to go to all the 5 original divisions of Lagos State. Well, we're here. We brought specialists, doctors, surgeons, folks in charge of, dentists, opticians. So we hope to help the less privileged in all the areas that we go, provide medical assistance to them. We have doctors that will check them, and we're going to give them medication. We're going to give folks eyeglasses. We're going to check their teeth. So essentially, just looking after the less privileged among us.
This is a non-profit organization started about year 2000 in US. So now we have about 24 chapters within US and Canada, US, Canada, and London. So and we are expanding to Paris and Germany this year. So currently I'm the chairman of the membership committee. So I can guarantee you before the end of the year we'll be in Germany. This is just to reach out to our community. So we cherish coming back home, doing this mission every 2 years. It's something we all look forward to. So most of our doctors and nurses, we plan our vacations and towards this period. And because this is the time we are able to mingle with our people right here in Lagos and try to help as many as we could.
Eco Club is into humanitarian services where we come back to Nigeria to give back to the community. We currently do this in the US where we are, and we felt it as an obligation to come back to Nigeria and do the same thing, to help the underprivileged and the less advantaged people who does not have enough money to take care of themselves. So this in conjunction with the government, we can't leave everything to Lagos State government. NGOs are up to it to help complement what the government is already doing. Today's outreach is a wonderful one. We have it set up in such a way that we'll be seeing a lot of people for different alignments. First of all, we will see them for general alignments, diabetes, high blood pressure, asthma. Then we go more specialized. We'll be doing breast cancer screening, which we will follow up with the medical hospitals. We'll be doing cervical cancer screening. which will be conducted here. And if there is anybody diagnosed with that, it will be followed up with lawsuits. Lagos State government will be doing PSA testing, which would be for prostate cancer screening, and all these patients will be followed up if we have any positive patients. We've been doing this for over 20 years. We do this every 2 years. This is a biannual project. And we go all over the Lagos State. We have 5 divisions of Lagos, and we make sure we touch each division of Lagos State. Well, with every mission, there is always challenges of trying to control the crowd, trying to get things set up initially, but when we get rolling, everything goes on right.
Some of the doctors, some of them, we have quite a slew of doctors, about 20, 25 of them that will be participating in the medical mission. These are some of the doctors, and I want to thank all of you for the spirit of volunteerism, for the spirit of altruism. Some of them have traveled from Maryland. Dr. Akusomi is from New York. He's from Minnesota, from Enugu, from far and near, to participate in the medical mission.
We come to Lagos every year. Eco Club organizes this mission for the most poor of the society, people who don't have access to health care. They can see doctor but no medication. They have a hernia to repair, they can't do it. They have abdominal surgery to do, they can't pay for it. We come with the passion every year to come and help these patients. And we go to various parts of Lagos, all the 5 divisions, depending on the number of volunteers. But not only doctors come for this mission. We have people that help us in nursing, in physical therapy, in dental therapy, in dentistry, women's health, and stuff like that. So we come with our forces. And we also have logistic people who are not in medicine, who help us organize this place, who help control the crowd, who help with everything we do so as to make this a mission possible, not a mission impossible.
The main thing is, the main question is, why not Lagos? You know, Lagos is very supportive. Lagos is progressive. The governments, all the different governments of Lagos since 2007, when we started this medical mission, have been very, very supportive and have given us all kinds of resources to make all these medical missions very successful ones. I am very happy that we are able to pass everything we've done and everything we've learned to the young ones. That's my joy, that we have a generation now who can take from what we've done and go along with it and even do a better job than us. I've been doing this since 2006. That was the planning year. The first mission was 2007. That's how long I've been doing it. We've had challenges along the way, but the most important thing is that we've been able to overcome all the challenges because the different administrations, the Fashola administration and the subsequent administrations have been very, very supportive of us. And so it's made all our job very easy, and almost all our medical missions have been successful ones.
It's a good initiative from Eco Club. It's my first time here. I think it's good to give back as much as possible, and that's the whole idea of the mission. Being Lagosians in diaspora, Nigerians in diaspora, I think it's important that we try to give back, try to help the community back home, and that's the whole point of it. So kudos to Eco Club, kudos to Lagos State government for putting all this together. Look forward to helping as much people as possible. I mean, looking outside, seeing the huge number of people waiting for us, that shows that there's a lot of help needed. And as much as possible, we'll try to provide as much help as possible.
This is just an avenue for me to meet with my colleagues that work in the diaspora, and then just to contribute my own quota to the society as well. This is my first attend. This is my first time joining them. I feel excited, really. You can see it over my face. I feel very excited. And I hope to have a nice time as well.
This is my first time of joining this mission, this particular mission. I'm expecting to learn new things, especially from my subordinates coming from the abroad, from diaspora. So I'm happy to work with them, yes, and to give back to the people of Lagos.
Beneficiaries were full of thanks for such a privilege.
Inú mi dùn torí mo ti wá bí láàárọ̀ tẹ́lẹ̀ ní kan bí 6:30 wọ́n ní wọ́n ti pín káàdì fáwọn èèyàn láti bí 3 weeks ago pé ká máa lọlé la fi lọlé ìyàwó mi kan ló wá pè mí pé ìyá Múṣí ó yẹ máa bọ̀ kíákíá mo dẹ̀ débí wọ́n dẹ̀ dá mi lóhùn mo dúpẹ́ gan lọ́wọ́ àwọn tó ṣe ètò yìí iléeṣẹ́ wọn ò ní jóná wọ́n á máa lọ́re wọ́n á máa bọ́re.
Mo dúpẹ́ lọ́wọ́ wọn fún àǹfààní tán ṣe fún wa ní ibi ìbà ilé nílé kábíyèsí ọba Ìsọlọ̀. Ọmọ mi Rílíwàn Nurudeen olówó pè mí pé kí n wá fún check-up pé wọ́n máa tọ́jú wọ́n máa fún wa lóògùn. Bó dẹ̀ ṣe wí náà ni mo ṣe bá bẹ́ẹ̀. Wọ́n tọ́jú wa, wọ́n kígbe mọ́ wa, wọ́n kanra mọ́ wa, wọ́n tún bá wa sọ̀rọ̀ pé ká máa jẹ nǹkan oríṣiríṣi, ká máa jèso, ká máa jẹ nǹkan tó dáa, ká máa tọ́jú ara wa pé tá bá ti ń tọ́jú ara wa ìgbádùn wa náà ní ọjọ́ ọ̀la. Wọ́n dẹ̀ gbowó oògùn lọ́wọ́ mi gba nǹkan kan, wọ́n tún ra nǹkan fáwọn àbí tí a jókòó pé ká tó fi panu.
Mo ti jẹ àǹfààní púpọ̀ lára Èkó club. Wọ́n try gangan, wọ́n try jù. Olúwa máa gbé wọn sókè. Iṣẹ́ tí wọ́n gbà yìí wọn ò ní fọmọ ṣe o, wọn ò ní fẹ̀mí wọn ṣe. Bí a ṣe ń gbé wa ga tí wọ́n ń tọ́jú wa, Ọlọ́run á tọ́jú wọn jù bẹ́ẹ̀ lọ. Gbogbo ìgbà tí wọ́n ń gbàgbé àwọn fẹ́ lọ sí ibikíbi tí wọ́n fẹ́ lọ níbi Ọlọ́run á máa gbé wọn débẹ̀.
The Èkó Club outreach went on for about a couple of weeks as they also visited some other parts of Lagos, including Ekpe, Isolo, Badagry, and so on. Indigenes of Ekpe came out in their numbers to benefit from this medical outreach. They were tested and given the medical attention they needed. The Olori of Ekpe commended Èkó Club for their kind gestures. She explained how much this outreach will impact the lives of the citizen, and she encouraged them to do more good things.
I welcome the organizers of this occasion for thinking it fit that the next place of God is Ekpe. We are very happy to receive you, and God will do with you in all your endeavors. Anywhere you move to, from here back to your station, Canada, Russia, I've been seeing Philadelphia, Èkó Club everywhere. Back to your station, God will do it. We will repay you in a millionfold. I thank all the others that are here from Ekpe, the Kábíyèsí and the Olóyè representatives of Kábíyèsí that are here. I'm grateful that we are all here.
I've known Èkó Club International for a long time. I've followed them to Ohio, to Rhode Island, their places. So many American countries where they host their guests. And I can say I'm a part of them because many of them know me and I know them. So they are good people and I enjoy being a part of them. I've heard about it over 2 weeks ago and I've been expecting the day comes so that we can enjoy the facilities they are bringing to Ekpe out of all places. They deem it fit to bring it to Ekpe. That's why I'm so happy about it. And God will be with them and always see them through when they are going back to their stations.
We spoke to some of the organizers and beneficiaries who were full of gratitude.
Èkó Club International, a global organization with about 23 chapters across the globe, giving back actively to communities in Lagos State where there are actual needs for healthcare and other type of relief programs. We ran into a few skirmishes at one of our locations because the people got a little bit impatient with, I guess with the pace that we were moving, and they forced their way into the venue. So we had to shut it down, essentially. But apart from that little event, it's been a very glorious medical mission. 2022 has been a blessing. We've been able to positively impact lives. On the average, I think we saw over 6,000 people, and we're still going strong. Traditionally, so when we started in 2007, it was meant to be an annual event. So we did 07, we did 08, and then realized that this is really cost intensive. It's not something that we can do every year, so we started doing it every other year. But one other thing that we have introduced this year is to take this type of mission at a lesser scale to different locations.
What we try to do this year is actually cover the 5 regions of Lagos State, which is Badagry, Epe, Ikorodu, Lagos Island, and then Badagry as well. So, and today happens to be the last day. We were at Ejiri yesterday, part of Epe as well. Oh, we have the pharmacy department, all right. We have the high department, and they do have glasses of various prescriptions. We have the dentists, we have various volunteers, the dentists and doctors, young and old, we have them here. We also have the team that are checking for prostate cancer and cervical cancer as well. We do have people that also check for the breast also.
The outreach is, I think it's a welcome event. I'm even glad it's taking place within our premises. It shows that we are able to collaborate to achieving something good for our people. I'm aware that not everybody will have the resources, financial means to be able to pay for medical care. At least once in a while, people should have this opportunity. And it's good because it shows that people within the division here are able to band together to finding solutions to the challenges, the health challenges that people have in Ekwe here. And then it also tells me personally, as the MD of the hospital, that there are resources within Ekwe that we can utilize, that we can collaborate with to achieving greater potential for the hospital and also to delivering better services for our people here in Ekwe. So I am glad we were able to pull through. We had a lot of discussion concerning this. We've been involved in several other outreaches, and this one from Eco Club is also something to be very proud of.
It's a very laudable achievement, and it's a very laudable event that we really appreciate the Eco Club. We just have to thank them and pray for them. Because there are a lot of Nigerians that are even richer and all this, but they are not doing all this stuff. So we need to encourage what they are doing, and we need to put our input into what they are doing. And I know Obalara would put some input into that project.
Having a medical outreach is a very good one, and I discovered this is what they do yearly. Their own little way of contributing back to the society. And whether we like it or not, we cannot totally close our eyes to the fact that people doesn't really have access to quality health care. When I say quality health care, I'm not trying to say we don't have quality health care in Nigeria, but because of some financial constraints and little awareness about people trying to do regular checkups, so most people don't. That's the aspect I'm talking about. But with this medical outreach, you can see the turnout. Within few hours, they've attended to over 200 set of people, and we have different classifications from diabetes to high dental and all that. So basically, it's a very good one, which we always encourage them to do.
I feel ohun tẹ́ gbé wá fún alẹ́ pẹ̀lẹ́ ní ìwòsàn ọ̀fẹ́ Ọlọ́run á ṣe ètò dá fún yín, á wo gbogbo yín sàn. Ibikíbi tẹ́tí ń ṣe gbogbo tó Ọlọ́run á fi púpọ̀ rọ́pò fún yín, ní dààmú, ẹ ṣé adúpẹ́ o.
Ṣé kí nǹkan tó ń ṣe tó gbé wá sí Ẹ̀pẹ̀lẹ́ ní inú mi dùn gan. In fact mi mọ bínú mi ṣe dùn tó torí mo ti ẹni complain lára gidi gan. Mo ṣe sọ pé mo wá complain lọ hospital ni bo since tó ti sọ pé ọmọ àgbé wá lé ní òun ló jẹ́ kí n dé bí bọ̀ inú mi dùn. Mo gbógun mo gbà fún ọmọ mi gan torí ọmọ mi náà wọ́n ní complain bọ̀ inú mi dùn gan. Ẹ ṣé mo dúpẹ́.
Inú mi so dùn púpọ̀ fún ìpè tó pè wá ní èní ètò ìlera yìí. Ọlọ́run á bá mi ràn wọ́n lọ́wọ́, á bá mi gbé wọn lọ́wọ́ sókè. Gbogbo iṣẹ́ ní wọn, gbogbo ẹ̀ ló máa gún régé. Wàláì tàláì sọ́bìláì, owó àti rògùn yóò pọ̀ fún mi. Àmọ́ inú mi dùn, wọ́n fún mi ní ọ̀fẹ́. Wọ́n ṣe àyẹ̀wò tó pérégé fún mi. Ọlọ́run á fún yín náà lálàáfíà ẹ ní rí dààmú.
Èní yìí dùn gan ni o, ó dùn gan ni torí gbogbo ògùn tó fún wa yà nífẹ̀ẹ́ sí Olúwa á dẹ̀ ràn wọ́n lọ́wọ́ àwọn náà ò ní ráàárẹ̀ wọn ní dààmú tọmọtọmọ wọn àlàáfíà kí àtàwa náà gùn fúnra wa ó dùn mọ́ wa gan o Olúwa ló lè san wọ́n lẹ́san kì í ṣàwa ló máa san wọ́n.
Àǹfààní tó pọ̀ rẹpẹtẹ ni torí nígbà mo débí nísìnyí tí wọ́n ṣe tẹ́sì fún mi tán gbogbo ohun tí mo complain pé ó máa ń ṣe mí gbogbo oògùn rẹ̀ wọn ni wọ́n fún mi kódà wọn ni mo kó lọ́wọ́ yìí tó jẹ́ pé tó jẹ́ àǹfààní tó jẹun tó bójúmu jẹ́ pé irú àǹfààní báyìí tí a bá ti ń rírò ẹ̀ ṣáájú àní máa sọ pé Nàìjíríà ò dáa ní báyìí ní ìsìnkú ipa náwó kankan lẹ́yìn pé kán gbà one time ànáwó wọn ò gbowó wọn ò gbáwọ́ náírà wọn ò gbá kọ́bọ̀ lọ́wọ́ wa lọ́fẹ̀ẹ́ ni.
Ètò tá a jẹ́ àǹfààní ẹ̀ pọ̀ o ní pé wọ́n fún wa lóògùn wọ́n yẹ̀ wá wò wọ́n yẹ̀ ọmú wò wọ́n yẹ̀ abẹ́ wò wọ́n yẹ̀ ojú wa wò wọ́n béèrè gbogbo nǹkan tó ń ṣe wá lára a dẹ̀ rí pé gbogbo ohun tán fún wa gbogbo ohun tá a béèrè náà ṣe fún wa. Àdúrà tá a máa ṣe fún wọn ni pé a dúpẹ́ fọ́lọ́run gbogbo àwọn tán wá sẹ́pẹ̀ ilé ní Ọlọ́run aṣọ wọn padà sílé wọn ò ní dààmú wọn ò ní rí wàhálà àwọn ọmọ wọn náà wọ́n á ṣe oríire wọn lálùbáríkà àwọn tèmi náà lálùbáríkà.
I'm very happy for what I see and I'm very happy for what they do. Everything is free. They make somebody sit comfortable and then they give the person drugs. They didn't collect money from me. They even asked me what is paining me. I told them what is paining me. They give me drugs free. They even told me if I have any pains I should come back. So I'm very happy.
The Eco Club outreach was concluded with a reception organized for members of the organization. It was a time to refresh and unwind from the week's activities. There was a lot to eat and drink at the event. Members were seen dancing and celebrating the successful completion of this year's medical outreach, as it was indeed a great project to be emulated. We at Eco Hot Blog congratulate all members of the Eco Club as we pray for strength for many more projects to come.
There's nothing more rewarding than giving back and making a difference in the lives of people in this great community. The advancement and upliftment of Lagos State has been the mission of Eco Club International. And today's event was indeed very eventful and impactful. And we are glad we were able to bring this to your viewing. Kindly ensure you follow us on all our social media platforms and don't forget to subscribe to our YouTube channel. My name is Olayinka Olorunshola. Thanks for watching.